Hi there, my name's Samuel Clark from the Movement Studio and the Spinal Recovery Program, and this video is relevant to you if you've had low back pain for a long time and you've been told it's down to changes in your spine like a transitional vertebrae or spondylosis or osteoarthritis or any other finding really on an MRI scan or an X-ray. And there's lots of treatments like cortisone injections and radio frequency ablation and prolotherapy to name but a few, which make up a tremendous part of back pain recovery in healthcare. This video is about helping you understand the actual effectiveness of these things in relation to your own recovery. And so firstly, we need to understand a simple truth, and that's this: us humans have a tendency to try and optimize. Now, focusing too much on optimization is something that we all do, and it's something that we all need to be aware of. We like to focus on making things better, and we have a tendency to do this before we've laid the fundamental foundations on a frequent basis. And you can see this across loads of elements in our culture. You know, we like to focus on high-tech things that sit in the top 10% and ignore the 90% foundational effort and consistency that it takes to get us there. You know, we give attention to the Formula One car and pay hardly any interest to the massive feats of engineering and the teams that make this thing possible. And we marvel at high-level sports people and pay very little interest to the up-and-coming athletes and to the efforts from the huge teams of people who push their progress forward. And the same thing is true in low back pain recovery. Put simply, because of all the pain and the suffering that comes with chronic back pain, we spend way too much time looking for those seemingly quick fix solutions and hoping that easy, simple way out of our complex problems will just emerge from nowhere. The interventions that we just talked about are prime examples of healthcare professionals getting caught up in that mindset and looking for that quick fix for their patients. And we see this on the internet too, with promises that the latest posture support gimmick will give people the relief that they're desperately looking for. You know, the overwhelming majority of clinical research out there shows that these things should be utilised as optional add-ons for low back pain recovery and not thought of as the foundational building blocks to getting people better. To add to the confusion, we also see a disproportionate amount of attention being given to pain management drugs, medical procedures and surgery when it comes to low back pain management and diagnosis. Again, focusing on that top 10% of what low back pain recovery is really all about and giving very little thought to the other 90%. And this problem is further underpinned by the outdated reductionist model for diagnosing and treating long-term back pain. And this is the way of thinking that attempts to nail down one single cause for people's pain, such as the findings on an MRI scan or an X-ray. And one of the most useful things that we teach our patients is that their pain is influenced by multiple factors. And this is extremely positive news for them because these are factors that they can learn to control and over time master. Delivering this kind of empowering information to patients with low back pain is something that we and other progressive healthcare clinics and faculties have been doing for a while. It's about showing people that the far-reaching influence of their pain can be controlled and it can be harnessed. It's not that back pain has to be this impossible problem that is never going to get solved. It's about finding simple solutions that fit the problem and not relying heavily on solutions that don't take us forward. I want you to imagine having a simple lock in a door, and on the other side of this door is all the things that low back pain is stopping us from doing. Moving with freedom, bending and lifting without fear of pain and injury, and getting uninterrupted sleep through the night, and all those other things that it affects. Now, getting through this door is relatively simple. All you've got to do is put the lock in, turn the key and just walk through it. But when we utilise outdated ideas about the causes and the cures to chronic low back pain, it's like having the wrong key to the lock. Getting through that metaphorical door is 1,000 times easier when a person is armed with the correct skills and the correct knowledge that allow them to have more control and more influence over their problem. Now, this is the new age method that is in line with the up-to-date clinical knowledge on helping people recover from chronic low back pain. You know, instead of using outdated knowledge that just trains people to sit there in pain with little idea about how to help themselves and then just hope that the next injection or the next drug is going to somehow restore the functionality of their body, we utilize these methods instead. In terms of chronic low back pain recovery, not having a clear plan of what we need to do and how we need to do it, and above all, why we're doing it, and then waiting for the next injection or the next therapy to magically cure our complex problem is a little bit like going to the gym and watching a personal trainer work out and then being confused as to why we're not getting the results that we want. And our objective is to be a big part of the solution to this problem. Wait, don't go just yet. If you found that content useful, then join our brand new Facebook group, Low Back Pain Recovery, and feel free to add me personally on Facebook as well. Again, my name's Samuel Clark, and in the picture, I'll be wearing this t-shirt. And of course, don't forget to like and subscribe to this channel, the Movement Studio programs. That's all for me. Again, my name's Samuel Clark from the Movement Studio and the Spinal Recovery Program, and enjoy the rest of your day.